Welcome to the Cincinnati VA. Thank you for taking the time to learn more about our pharmacy residency programs. Our well-established programs train 4 PGY1 and 2 psychiatric PGY2 residents each year. As a resident here, you will work as a member of a collaborative practice team to care for patients in both inpatient and outpatient. This residency ensures exposure not only to direct patient care, but also to leadership and practice management. With a wide variety of electives, we are sure you will find your passion for pharmacy and patient care here. Supportive and competent preceptors help to guide and coach you throughout the year, allowing for a personalized experience.
When I first came to interview here as an incoming resident, I was amazed by how happy all of the current residents were and the preceptors interacting with each other. And it was a family that I wanted to be a part of, and that also made me want to stay on and continue to work here.
First and foremost, the biggest thing that I noticed was just the people. When I was doing all of the interactions like during mid-year and getting ready for residency as a fourth-year pharmacy student, what really stood out to me was the preceptors and the other residents that I interacted with at Cincinnati VA, at a lot of the different regional meetings, and again at mid-year. They remembered my name, they remembered who I was, they came by and they checked out my poster, which was wonderful. And I feel like I just got a great feeling about the people that worked here, and that's certainly rang true when I got here. Everybody's been fantastic and they've been wonderful to work with. I would definitely say there's pretty vast variability with the electives, with the core rotations that we have. My electives, I had PGY 1 year, I was able to see a lot of inpatient, outpatient, sort of in between with residential programs, same for PGY2, and we have some opportunities that really let you see just a very broad range of pharmacy practice and even potentially work with some non-pharmacy preceptors and providers to get a great perspective on not just pharmacy practice, but healthcare practice in general, social work, a lot of the other supporting modalities that work really closely with us. So I've been able to see a much broader variety of experiences than I think I ever would have gotten anywhere else. I'm surprised and amazed at how vast our program is and how many different things I've been able to see over the past 2 years.
There's lots of opportunities for residents to really design a path throughout our program that meets their interest. While I'm on the outpatient setting, there's lots of inpatient opportunities as well. Whether you want to work with infectious disease or cardiology or our pain clinics, there's great preceptors who have started great clinical programs within each of those settings and offer opportunities for residents to join them as well.
Even while I'm doing the PGY2, I felt very well-rounded and prepared for just about anything that I came across.
We really do like working in an interdisciplinary setting where we have nurses and doctors, nurse practitioners, chiropractors, all sorts of different providers working together with the common goal of helping patients do better and meet their goals.
Complex psychiatric patients sometimes require a deep dive into the medical record and the scientific literature that can take hours, which is time that the clinical pharmacist and I just do not have. The pharmacy residents have served an incredibly important role in doing those thorough investigations, often finding therapeutic opportunities and identifying risks that I might have missed. The pharmacy residents are absolutely integral members of the patient care team.
I feel like feedback is probably the most important thing here at Cincinnati VA, especially with both the PGY1 and PGY2 program directors. Everybody is super open to feedback, and while I've been here for the past 2 years, I've seen pretty major changes happen with both programs based off of what feedback the residents have given. And even from last year as a PGY1 to this year, I've already seen some pretty substantial changes that have been made for the better. Everything seems to be constantly evolving and improving, and it's great to see that they really do listen to the residents very well.
Regardless wherever you do a residency, it will be challenging. You'll have lots of different balls to juggle, lots of deadlines to meet. And I remember feeling very overwhelmed having my primary rotation and long-term projects and trying to figure out a new computer system all at the same time. But when you know that there's a lot of people around you that have done it before, it makes it a lot easier.
My first couple of months of residency, I was stressed. I had a lot on my plate and I had a lot of personal things going on as well. And a lot of my preceptors reached out to me and actually asked me if I was doing okay and pointed me in directions to places to get help. And I got the help through the VA, through my preceptors, and it was great. It was a really easy process, and everybody has been super open. Multiple times just through the year, I've had preceptors ask me, how are you doing? How are you feeling? How's residency going? And they genuinely mean it. It's not just small talk.
And while the year will be challenging, you will have our support as well. We want you to have a great work-life balance, but the year will also be full of great experiences.
I think working with veterans is one of the best selling points of the VA in general. It's a great population to work with. There's such a wide variety of patients, and I think it's very rewarding. I personally have a family connection to veterans. My grandfather was a veteran, and that's part of what drove me into wanting to work for the VA. And getting the ability to work with people like him has really been very fulfilling for the past couple of years.
I've really enjoyed getting to know all of the staff. I think we work well together, and they offer a lot of good support on good days and on bad. We celebrate life events together, and I think you'll have a lot of fun being here.
Thank you for considering a residency at the Cincinnati VA. We hope to see you soon.